So our next speaker is Dr. Biju. So let me bring Dr. Biju on stage, please. Just give me a minute. Dr. Biju,
Thank you,
welcome.
Amarjit. I'm here. I hope
Allow
I'm
me to
audible.
introduce you.
Yeah, please
Allow
go
me
ahead.
to introduce you. So, yes, I can see a lot of people have exercise today, and definitely the topic itself is on the relation between exercise and cancer. All right. But Dr. Biju is a leading expert in genomics and wellness with over 18 years of experience. He's the head of genomics at V Roots and the academic director at Vigyan Academy, and he combines functional medicine with exercise to prevent and manage chronic diseases, including cancer. He's a certified medical exercise specialist as well, and he's a passionate marathoner, as already explained. And Dr. Biju's personal journey actually highlights the incredible impact exercise can have on your health. Now, today he's going to shed light on this vital aspect, but often overlooked aspect of the link between exercise and cancer prevention. So, please welcome Dr. Biju. Thank you so much for coming to the conference.
Thank you. Thank you for having me here in this wonderful conference, Amarjit, and all the other participants who are out there. A great day is actually happening here. So, just a small introduction about me, apart from what Amarjit has said. I have completed my medical graduation in 2006, and after that, I had the privilege to work in a hospital which treats only lifestyle diseases like diabetes, obesity, hypertension, thyroid dysfunction, etc. So from my initial days of practice itself, I was supposed to treat the disease without any medications. Can you imagine? In 2006. Now you might be thinking that it is actually possible. In 2006, it was very tough. But my mentor always wanted me to treat disease without any medications. But somehow I learned that nutrition plays a very big role, exercise plays a very big role. After my post graduation, then I did a course on nutrition that is especially for doctors, which is happening from National Institute of Nutrition, Hyderabad. Then I thought of doing a course in exercise physiology. I did it from ACE, that means American College of Exercise. And along the journey, I completed my MBA also from IIM. So right now, actually, I'm handling the business management also from my company. And finally, I came across with functional medicine, maybe through Dr. Ashwini, and I completed my course from IFM also. This is my small introduction. So when it comes to exercise, we all doctors may not be giving that much importance, even in the functional medicine space. Last time when we met, I think Dr. Ashwini will be remembering, we should be giving more importance to exercise in our treatments. Say, example, even as a functional medicine practitioners, most of the time I give more importance to nutrition, sometimes more supplements, sometimes peptides, sometimes gut health. Yes, exercise plays a very big role when it comes to managing these lifestyle diseases, including cancer. So let me share my screen here. I hope my screen is visible. Am
Yes,
I?
yes,
Thank
yes.
you. So how exercise protect us? So this is actually in a two phases when it comes to prevention of cancers or reducing the risk of getting into the state of cancer, and also in the part of treatment, how we can include exercise. I believe that most of the participants right now here are actually practitioners, whether doctors, nutritionists, physiotherapists, or some well-wishers are out there. Even patients may be there. So I'm saying that in terms of prevention, how we can how we can prescribe exercise, what are the real things happening, real physiology happening behind the exercise or in the body when it comes to prevention of cancer, when it comes to management or treatment of cancer. Let me say that when it comes to cancer treatment, in the coming days are actually going to be the space is actually occupying by immunology. How many of you are actually believing that? The space of cancer treatment is going to occupy by immunology. Means, say for example, we used to say about precision medicine, like that. Right now, we know that when it comes to cancer treatment, most of the treatment are mainly directed to the chemotherapy or mainstream treatment. I'm saying that, or chemotherapy or any radiation. But when it comes to immunology, the basics is like that our immune system, whatever functional medicine doctors or lifestyle medicine practitioners used to say, our immune system has the capability of reducing or killing those natural the cancer cells.
Dr.
So,
Biju, sorry for the intervention. Could you
yes,
please increase the volume at your side, or maybe increase it from the audio settings?
let me check.
Leave the audio is a little low, the volume is a little low.
Just a minute. How is it now?
It's the same. Maybe okay, all right, fine. So if in case the audio is not unwell at the audience's end, I would request you to kindly increase the volume at your end. Thank you. Sorry for the intervention, Dr. Biju.
Okay.
You may.
So when it comes to immunology, as I'm saying that the treatment is will be in a precision manner. Why I'm saying like that? See, we know that as a functional medicine doctor, as a lifestyle medicine doctors, our body, our immune system has the capability of reducing or killing those cancer cells. What if I told you the immunology can help our immune system or these particular immune cells to kill those cancer cells? Those kind of actually treatment is coming maybe in the 5-10 years to the maximum 20 years. It's going to take up the place. But let me tell you the fact that this exercise plays a very big role in increasing the activity of natural killer cells. For those who are out there who are not doctors, maybe patients, please understand that these are the immune cells, natural killer cells, cytotoxic T cells, various other T cells will be helping our body to recover from cancer. What exactly we are doing when we are, say example, we are treating the cancer with our lifestyle modifications, exactly our immune system is increasing its activity to reduce the cancer cell or to kill the cancer cell. Exercise plays a very big role when it comes to increasing the activity of natural killer cells or increasing the activity of cytotoxic T cells. Apart from that, we all know that exercise can improve the immune surveillance. Means our body, our immune system is like our police, means keeping beating all the way around to find those bad cells, made autophagy, made various other mechanism. It is going to kill these research paper can improve the immune surveillance for sure. Then the next mechanism is exercise reduces the chronic inflammation. We know that as lifestyle medicine practitioners or functional medicine practitioners, chronic inflammation plays a very big role when it comes to aging and longevity, when it comes to cancer, etc. Yes, exercise can help reduce the inflammatory cytokines. It can help the fat tissue, the total fat percentage in the body. There are lot of or enough evidence are out there when there is a connection between obesity and cancer. There is a connection between insulin resistance and cancer. We know that exercise can reduce insulin resistance, reduce the total fat, body fat percentage. We know that when we do exercise in its correct way, it can improve the total muscle mass. It is proven that muscle is considered to be the longevity organ. I repeat, muscle is considered to be the longevity organ. Again, inside the muscle can act as an anti-inflammatory organ in various chronic inflammatory processes. Means during the chronic inflammation, which can end up with some cancers, it can reduce, our exercise can reduce the intensity or the risk of getting into the state of cancer. Yes, we all know that oxidative stress is playing a very big role as functional medicine practitioners. Most of the doctors will be prescribing most of the antioxidants. Why? In order to reduce the oxidative stress. Please understand that exercise can reduce the oxidative stress. And more importantly, these days, most of the functional medicine doctor, including me, are giving more importance to gut microbiome. Yes, exercise can improve the quality, the good quality gut microbiome in our body. A lot of papers are out there. I'm going to give you the link of the papers so that you can go through whatever clear-cut research papers are out there. Whatever papers are out there, I have selected according to the methodology they have used for their studies, according to the statistics action to exercise for its prevention and also treatment. Then another way is that exercise regulates the hormone levels. We know that the first and foremost, hormone when I'm telling you about exercise and cancer connection is just insulin. We know that there is a big connection with insulin resistance and cancer. How? Say, it start with slight insulin resistance. It can end up with some metabolic issues. It can end up with some metabolic syndrome. Say, example, fatty liver. It can extend up to grade 1, 2, 3. It can end up to cirrhosis. Later on, it can end up with hepatocellular carcinoma. Various other cancers can end up in the same pathway. Means where it starts from insulin resistance. We know that exercise can regulate the insulin level to the normal. Same in the case of estrogen, same in the case of testosterone. There are a lot of papers which clearly proves that these hormones, including growth factors like IGF-1, has proven that it has connection with various cancers. The levels or the variation in estrogen, in testosterone, in growth factors, it has direct connection with various cancers, and exercise can regulate these hormones for sure. Again, exercise improves DNA repair. We know that most of the cancers are actually happening in our body due to the mutation, we used to say. Yes, all the time, as a doctor who is working in the field of genomics and epigenetics, I can clearly tell you that all the time in our body, our genes are getting mutated, but our body is correcting it. I repeat, our genes are getting slightly variation, and our body's DNA is actually getting repaired to the normal stage. Here, exercise has a direct impact in repairing this DNA if it is getting mutated in a very small way. We call it as SNPs, or when you check with the genomics, we always look for these SNPs. Yes, exercise can correct these SNPs if it is happening through the mechanism of, most of the time, epigenetics. I'm going to explain the epigenetics in 5 minutes. In the next slide. Yes, exercise can enhance the body's repairing process. We all know that it promotes a healthy epigenetic mechanism. Whether it is methylation, whether it is acetylation, ubiquitination, everything, every epigenetic mechanisms are actually definitely our exercise can play a very big role in correcting these kind of epigenetic mechanism. Moreover, exercise promotes a healthy weight management. And I should say that this is the most important part when it comes to weight management, whether it is overweight, obesity, or body fat percentage. If it is at higher level, there is a correct correlation with cancer and our obesity or fat percentage. We all know that exercise plays a very big role in reducing the insulin resistance, in reducing the total body fat percentage. When it comes to specific cancers, whether it is colon cancer, there are huge number of papers out there, research papers out there, which proves the connection between or reducing the risk of getting into the state of colon cancer and exercise. Same in the case of breast cancer, same in the case of prostate, endometrial, liver cirrhosis, etc. Huge number of papers are out there. So as functional medicine practitioners and lifestyle medicine practitioners, I should say that we should be prescribing, I repeat, we should be prescribing exercise to our clients. Because, my dear friends, doctors, the evidence is compelling. See, as a functional medicine doctor, I should say that, and also I'm actually working in my company as a product manager, finding various combination of the supplements for, say, joint health, for even improving the immunity. I should say that whenever I do a research for improving the immunity for any cancerous or anti-cancerous supplements, like say, whether it is any kind of mushroom, ashwagandha, etc., I should say that compelling evidences in terms of research papers are more on the exercise side than these kind of supplements. I should say that. Yes, the evidence is so compelling. So all doctors out there, we should be prescribing exercise in order to prevent, even if the patient is actually affected with cancer, we should start with at least slight exercise in order to reduce the intensity of the disease, in order to get more treatment adherence, or in order to make the patient in a reversal of the disease. Exercise plays a very big role. It can help in improving the survival rate. It can help in enhancing the treatment response for sure. So as doctors, you might be wondering how we can prescribe and how much exercise we can prescribe. and what kind of exercise we can prescribe. If you are in doubt, so please be attentive for the next 5 minutes. In these two slides, I'm going to explain how you can prescribe an exercise for any patient if they want to reduce the risk of cancer, or if they are undergoing treatment under you, if they are having any kind of cancers. Yes, we should be considering the individual factors such as age, current fitness level, health condition, genetic predisposition. All these factors should be taken into account. These are all very well aware about for all the doctors out there. Then we should be sticking on to the fit principle. What is fit principle? It's all about frequency of exercise, the intensity of exercise, time duration of the exercise, and type of exercise. These are very, very important when it comes to prescribing exercise for, even if it is a preventive mode or if it's a treatment mode. This is very important. Fit principle, that means frequency, intensity, time, and type are very important when we are actually prescribing. I'm going to teach you very simple 2 steps so that you can prescribe this kind of exercise to any patients out there. Then one thing you need to be understand that when it comes to exercise, we need to assess the present physical condition of the case. If the person is not accustomed to do any kind of exercise, then we should be starting the exercise in a very, very gradual way. Thereby, it can progress to the maximum, whatever your desire, whatever your target of, according to the frequency, according to the intensity, time duration, and time. Then another important factor is the motivation and coaching. We must have heard about the fitness coaching, but some 10 years back, there is no nutrition coaching. But at this point of time, we are actually hearing the word nutrition coaching. See, at 10 years back, I can say that in my hospital also, nutritionists usually prescribe a diet. Usually they have printed say example, 10 different type of diet plan. If a patient comes, they will pick choose one diet plan and give it to them. Now the scenario has changed. Yes, the patient can go to ChatGPT or Gemini. They can create their diet thereon for sure. So what's the point of a nutritionist here? Now they have actually changed to the coaching mode, means they are giving more supportive in terms of exercise. It is already there because people require motivation, people require coaching, people require support. Yes, with the help of a health coach, or if you're a doctor, if you know the basics of coaching, then definitely you can help your clients in terms of sticking on to the exercise that you are actually prescribing to your clients. In the next slide, I'm going to tell you how you can prescribe exercise. There are various n number of metrics are out there, different methods are out there. If you go to different gyms, different trainers will be telling you different type of exercise, and everyone will be claiming that this is the right way. As medical practitioners, you just stick onto these two important areas when it comes to prevention of cancer while you are actually prescribing exercise, when it comes to treatment of cancers while you are actually prescribing exercise. First important metric is METs, metabolic equivalent task, we call it as, or METs. What is METs? Say, for example, if actually I am actually speaking to you, my METs can be calculated as, or can be say as 1.5, but all the other participants who are right now listening me, or right now, if you are not doing any other kind of physical activities or any other activities which require some exertion, your METs is calculated as 1. I repeat, your METs is calculated as 1. Suppose you are doing some household chores, or say walking at a speed of 3 km per hour, means walking at a very, very small pace, your METs can be 2 to the maximum of 3. Means very light intensity of exercise is, METs means 1 to 3 means very light intensity of exercise. If you are suggesting any kind of exercise where the METs is 3 to 6, means moderate intensity of exercise. Say, for example, if you are walking at a speed of or a pace of 6 km per hour, then it can be considered as a METs of between 3 to 6, depending upon your lean body mass, etc. But please understand that any moderate intensity exercise, while you can feel your heart rate, okay, then it can be considered as a METs between 3 to 6. In order to prevent any cancerous condition, in order to or when it comes to the treatment of various cancer conditions, the METs can be 3 to 6 because research papers have proven that when it comes to the METs between 3 to 6, that is the value by which it gives maximum protection when it comes to prevention, maximum results when it comes to reversing or the cancer condition or helping the patient's immunology to at a better level. That is one simple metric, METs. The second one is zone. That means our heart rate can be calculated by the help of a smartwatch. If your client is having a smartwatch, this is the best metric that you can use. If your client is actually working out in a zone of 3 to 4. So what is zone 3? What is zone 4? Let me explain. Say there is actually a metric which says that maximum heart rate. Suppose if I am actually at the age of 40 years of age, my maximum heart rate is calculated by 220 minus my age, that is 40. 220 minus 40 means 180. If I am working out in zone 1 means 50 to 60% of the maximum heart rate. My maximum heart rate is 180, means 50 to 60% means there can be around 90 to 110. If I am in zone 3 to zone 4, means if it is around 70% to 90% of maximum heart rate. 70% of 180 means around 126, I think. 90% means around 160. In a rough calculation, if you are at 40 years of age, if you are doing exercise while your heart beats at a stage of 126 to around some, I can say 144, I think. Yeah, 144. That is the best way in order to reduce the risk of various cancers. And when it comes to treatment also, this is the best zone because research papers says like that. So please understand that METs 3 to 6, zone 2, zone 3 and zone 4 are the best way that you can suggest exercise. I'm not saying that this is the best exercise. Any type of exercise, whether you are doing yoga, Zumba dance, weight training, all these exercise, when it comes to the physiology of exercise, keep in mind that your heart rate should be at a level that it should, if it is between, say for example, in my case, it can be 126 or 126 to 145. That's the best way I can prevent my or reduce the risk of getting into the state of cancer. So exercise and cancer survivors means when it comes to treatment for these cancer survivors, they can improve the quality of life, they can reduce the risk, they can enhance the treatment tolerance, they can better manage the side effects also. So when it comes to cancer genomics, I said that when it comes to the methylation, acetylation, histone modification, exercise plays a very big role. In this picture, these red ball-like structures, these green triangular structures, these are actually the epigenomes. Exercise has a direct impact on these epigenomes, which will help to suppress those bad genes which is present in our body. So there are two case studies. In 1 minute, I'm going to wind it up. This is my personal case study from Trivandrum. The person is diagnosed with Hodgkin's lymphoma. He was actually obese at that point of time. He was actually motivated to regain control of his health, reduced his BMI. His BMI was 32 at that point of time. It was reduced to 24. He completed his first marathon and he participated in a triathlon event also. Now, there is no medicine at all except high dose of omega-3 fatty acid and a vitamin C, an antioxidant tablet. That's all. This is the medicine. This is the supplements he's actually taking these days. Another case is Sarojini. The name is actually changed. She was actually a breast cancer survivor. Interestingly, her son is actually a fitness trainer. At the age of 54, she started doing exercise. And believe me, it produced a profound effect. And the oncologist was surprised, very much surprised to see the result in her body after she changed her body weight, increased the muscle mass, because after chemotherapy, she lost a lot of muscle, but now she regained the muscle. Yes, of course, her son helped her a lot, but it produced a profound result over there. So Now, any questions over there? I'm happy to answer. If you do have any doubts, if you want to contact me, I'll be sharing my number here. Feel free to contact me also. Any doubts out there?
Thank you so much, Dr. Biju. I'm pretty sure that was a very another insightful session. I will just be request you to kindly just stop sharing the screen. Participants, the details of every speaker is also being sent on the chat box. So look into that as well as the WhatsApp. So yes, there were a couple of questions and I would take them. So if a patient has severe fatigue due to chemo, will it help exercising?
Yes, for sure. That's what happened for my first client because in the case of Sarojini, it was very difficult to start with the exercise. Yes, there is actually a break-even point. Say, for example, when you are actually going to the gym for the first time, first 2 3 days it was very tough. Most of the people actually quit. But once you break that even break-even point, then definitely it will help. It is possible. It's according to the ability, according to the energy level, along with us, we as a functional medicine practitioners, we can improve their energy level with various other supplements along with slight intensity exercise can be prescribed for sure. And in my practice, I should say that most of the time, these patients are actually a downside, mainly because of their mental or their depressive stage. If there is a supportive mechanism, they will be doing exercise for sure.
I think you have very rightly said, and this has been reiterated by every other speaker throughout the conference, the mental frame, the beliefs that the people have, how they go about with it is going to make a major difference. Um,
So
uh,
I'll be sharing, just 1 minute, I'll be sharing the
yes,
uh, link of the papers and valid papers are out there. I have uh, write down all these papers in a document. You can get this document and go through this document, get these
dear
papers.
participants, please have a look at the chat box. Dr. Biju has shared a link and you can access it. Those are papers related to exercise. So, wonderfully explained there. I couldn't see any further questions though, even though one is saying that, yeah, gym is not advisable and probably rehab exercise is required. So, would you like to put in, throw some light there?
Yes, when it comes to exercise prescription, most of the time it is required by a specialist is required most of the time. I should say we as functional medicine doctors, we should be learning the very basics of exercise also. We have already learned when it comes to rehabilitation also, we should be learning something about exercise. This will definitely help in improving the quality of life. One question is there, will supplement help to do the exercise invade their fatigue like carnitine? Yes, of course, carnitine, magnesium is playing a very big role. I used to suggest magnesium IV for these kind of patients while they are doing exercises.
Magnesium is itself a huge topic in itself.
Yep.
So, thank you very much once again. And thank you for your wonderful time and the insights that you've thrown on exercise and its relation with cancer. Thank you once again for being in the conference.
Pleasure is mine. Thank you.